This is your question. Few seconds left.
Okay, I'm going to enter the station. I'm going to wash my hand.
Yeah, just 5
Okay,
seconds.
Okay.
You'll hear the bell. Now, right. So if you've read and understood, consider clinical examination statement. Kindly begin.
Okay, I'm going to enter into the station. I'm going to wash my hand. I'm Dr. Oluwade, one of the surgical doctors. Can I please confirm your name and age, please?
I'm Smith, 55 years old.
Okay, I've been asked to examine you today. Is that okay by you, Smith?
Yes.
Okay, all right. So I'm going to expose the patient. I'm going exposing the chest and then the abdomen and then making sure that it's in the cardiac position. Okay, so I want to examine you, Smith. Do you have any pain anywhere now, Smith?
Yes.
Okay, where do you have the pain?
In my chest.
Oh, I'm sorry about that, Smith. So I'm going to, can I give you analgesics before I go ahead? Or you're okay, Smith?
That's okay, you continue.
Okay,
You
all right.
notice patient has oxygen mask on his face.
Oh,
so
okay.
You lift
So
the
because
mask to see if, yes, continue please. What else you'll do?
So because Smith has oxygen is on oxygen, he's also having chest pain, and I can also see that he has difficulty with breathing. I'm going to manage Ccrisp using the Ccrisp protocol. So I'm going to start by, since he's able to, I'm also going to look around to see if he has the oxygen that he's taking, the liters that he's taking, and then also check if he has any drugs on his table, like inhaler that he's also using. So I'm going to start with the A. Since he's talk, I'm sure that the airway is patent. I'm also going to check the mouth to see if he has any foreign body in his mouth. Then I'm going to go to the B. So I'm going to check. Please, can you please open your mouth? Okay. I'm checking. Stick out your tongue. I'm checking for central cyanosis. Then I'm going to go to the chest to check to look at the chest. If the chest is the shape of the chest, and then also, so I'm going to put my hand on your chest. I'm trying to see your chest expansion.
I'm
going to check for.
Okay, you're looking at the chest shape, and if you'll notice if the chest wall is moving or not.
Is barren or yes, it's moving or not, and then the shape of it is barren shape
the
or
trachea,
normal
if
shape.
If it is central or not, you'll
then quickly, I'm going to check.
Yes, please.
So on both sides, then I'm going to across the chest to see the other, and then also going to focus on the lat as well. So now breathe on both sides and also on the lateral side. Then the 99.
Yes.
Expansion, auscultate it and also back on the back as well. Then I'm also going to check the sacra and to see if there's any sacral edema. Then also, can you lie down back? So I'm going to check and now to move to the circulation. I'm going to count the pulse just to make sure that whether it's regular or irregular. Then I'm going to look over the precardium to see if there's overactivity there. Then I'm also going to palpate and look at the apex beat. Then also I'm going to listen to your heart sound now. So I'm going to put my stethoscope and auscultate over there to see, and then also going to feel over the areas of the other heart valves to see if there's any murmur. By putting my hand to feel for 3, and then also listening over all the other heart valves. Then I'm going to go to your leg. Do you have pain at your leg now, Smith?
Yes.
Oh, sorry about that. So to check the leg whether it's on TED stockings or not, I'm going to feel for
patient does not have TED stocking, but
Then I'm going to feel for pedal edema, and then I'm going to touch the
Squeeze.
calf muscle,
Yes.
squeeze both calf muscles to see if it's tender or not,
Tender or not,
and then
okay.
watch his face, and if there is swelling on any of them. Then I'm going to, after this one, I'm going to check the vital signs, this chart, to see what the chart is showing.
Yes.
Then I also want to check your examine the wound. So I want to remove the wound on your right hip and look at
Examiner will say
if there's
consider.
any.
Yes.
Okay, so after this one, then I'm going to summarize my findings. I've examined Smith, a 55-year-old man who is 8 days post-op. He has difficulty and features of respiratory distress with and also tenderness on the right chest, on his right chest. He also has reduced air entry bilaterally on his chest, and then has swollen calf and also tender calf. So I'm thinking of a possible pulmonary embolism. His vital signs also shows features of reducing oxygen saturation, and it's also on oxygen.
How much oxygen was patient taking?
Yes, it's on 6 liters oxygen via face mask.
Okay, without face mask. Okay. Yes. Were there any? Yes. All right. So what are your provision? You told me your provisional diagnosis. What other differential diagnosis would you consider?
Yes, my differential diagnosis also include broncho pneumonia.
Yes,
and then,
or MI.
Or myocardial infarction.
Okay. What investigations would you ask for to confirm your diagnosis?
I want, if the renal status of the patient is fine, I want to do a CT pulmonary angiography to confirm features of pulmonary embolism. I want to tachycardia or right atrial deviation on the ECG, and then also D-dimers and full blood count for the patient.
And ECG, simple and easy.
Yes, I mentioned ECG.
You did mention, okay.
And chest X-ray.
Okay. In ECG, if you suspect it's to be pulmonary embolism, what would you see?
Yes, the patient will have sinus tachycardia. There may be right axis deviation also on the ECG, and there will be
inversion.
Right axis
T-wave
deviation.
Inversion. Okay.
And
yes.
The Q wave.
All right.
Inversion. T-wave inversion.
Yes. All right. Can you tell me how should a pulmonary embolism be managed?
Yes, if it is a depends on whether if it's a massive one, patient, I will transfer the patient to the intensive care unit. Patient will manage in intensive care unit. I'm going to intubate the patient, give patient oxygen, and then I'll start heparin for the patient, to anticoagulate the patient to for the one. If the patient has the massive embolism, patient will need to have the embolectomy done to remove the embolus.
Yes, if patient is stable and patient just like this patient, and you suspect it to be mild or moderate pulmonary embolism, how would you manage the patient?
Yes, for mild one, I'll give oxygen, I'll give anticoagulation, and then morphine to relieve pain.
Which
I want to give one to
anticoagulant, and how much? Which through which route?
Yes, I want to give
cutaneous
IV yes. Anticoagulant or subcutaneous heparin.
If patient is mild, then subcutaneous heparin is okay.
Okay.
And you'll involve the medical team in it. Okay, just suppose you're washed up and you're in theater, you're scrubbed, and a nurse informs you about this patient. What would you do?
Yes, I will call the crash team to
immediately. Yes.
Put a crash call to review the patient and manage the patient.
Good. Okay, thank you.